For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning. I'm Hillary Armstrong, a Public Information Officer with the County of Santa Clara. Thank you for being with us here today as we announce a no wrong door policy for vaccinating residents over the age of 65 throughout sites at Santa Clara County. Joining us today, we have Dr. Sarah Cody, Health Officer and Director of Public Health for the County of Santa Clara, Supervisor Joe Simidian with District 5 of the Board of Supervisors for the County of Santa Clara, and Dr. Jeff Smith, County Executive with the County of Santa Clara. Our speakers will repeat the questions into the microphone for our Facebook Live audience. Following the conclusion of the English and ASL portion of the press conference, we will have statements from the podium in Spanish, Vietnamese, Chinese, and Tagalog. Thank you very much, and with that, I will introduce Dr. Sarah Cody.
Good morning, everyone, and thank you for being here as always. This is a ritual that we've now been involved with together for well over a year. Today, we are announcing that the county and many of our health system partners across the county will be offering COVID-19 vaccine to all county residents 65 years of age and older with no wrong door. So as you know, it's been almost exactly a year and a week since we announced our first case in a returning traveler from Wuhan. And now we have over 100,000 cases, and we are closing in on 1,500 deaths. 1,473 people, to be exact, have died of COVID-19 in our community. And we know that over 80% of those who have died are 65 years and older. So going forward, we must and we can prevent as many of these deaths as we collectively are able. So never did I imagine a year ago when we were all together that we would be where we are today, to have lost so many of our community members, to have our children at home on Zoom school, and to have our lives still totally upended. But then again, never did I imagine a year ago that we would be weeks into a vaccination campaign and have a safe and effective vaccine against COVID-19, and we do. So our challenge now is to roll out our vaccination campaign as efficiently and effectively as we can to get those vaccines into the arms of those who are most vulnerable and most likely to die of this infection. But given that we still have scarcity of this vaccine, we still have limited supply, and frankly, we still have a rather chaotic environment with changing state guidance almost daily, it's a challenge. But we're here to meet the challenge, and that's part of our announcement today, with a very simple message that everyone who lives in our county who is age 65 years of older can get vaccinated. There is no wrong door. You can come to any of the health systems. We're also committed to ensuring that people who live in communities in our county that have been hardest hit by COVID-19 have as few barriers as possible to getting vaccinated. And that means sort of two things. One is that we bring vaccination to those communities and that we bring people in those communities to our vaccination sites. And we're working with our community stakeholders on both of those efforts. So with all of us working together, I know that we can prevent more illness, and we certainly can prevent more deaths. And we are delighted to have everyone working together to protect our community. Thank you so much, and I'd like to introduce Supervisor Joe Simidian, who is from my district. I am his constituent. Supervisor.
Thank you very much. Good morning, all. As you heard, I'm County Supervisor Joe Simidian. I represent the 5th Supervisorial District, which is the northwest portion of the county. I represent about 8 of the city's 15 cities and towns in whole or in part, about 400,000 of the 2 million residents of Santa Clara County. I wanted to say that our effort to get more and more folks vaccinated requires both simplicity and clarity. And we've had too little of both, quite frankly, until today. Today's announcement is a very important step in the right direction. And I think what I'd like to share with you today is the notion that if we say we're all in this together, we have to mean it. We have to provide access to the vaccine, and that access cannot be dependent on who your healthcare provider is or the number of vaccines they happen to have received in any given week. We've got to give every resident of Santa Clara County access to the vaccine, consistent with federal, state, and local criteria, and we have to do it faster. So while there will be many challenges to this effort in the coming weeks and months, I'm convinced that today's announcement really will get us there more fully, more fairly, and certainly faster. Now, just to put this in perspective with respect to the kind of numbers we're talking about, prior to today, under the state system, roughly half of the county's population was served by, and continues to be served by, what we call multi-county entities. That's the state term of art. What that means is that 1 million residents of the 2 million residents in this county were looking to their providers, Kaiser and Sutter, also known as Palo Alto Medical Foundation, to access the vaccine. And if in any given week, either one or both of those two healthcare providers didn't have the vaccine, that meant those folks were out of luck. As you've just heard from Dr. Cody, this no wrong door policy means that fully half, 1 million of the 2 million residents of this county who previously were unable to access the vaccine through our county are now eligible to do that. All 2 million residents of the County of Santa Clara, if they are eligible, if they fit the criteria with respect to age and circumstance, will now be able to come to our county or to their healthcare provider, but again, with no wrong door. So this is very good news indeed for literally 1 million residents of this county who now know that their access to the vaccine will not be dependent on who their healthcare provider is and or what kind of allocation they've had in the days and weeks prior. Thank you very much, and it's a good news day. Let me turn it over to Dr. Jeff Smith, our CEO, for final comments, and then, of course, happy to take questions if you have them.
Hello, thank you for coming today. Again, my name is Jeff Smith. I'm the County Executive for the County of Santa Clara. And I'd like to talk to you a little bit about our county health system and how we're participating in this new initiative. The county health system in Santa Clara is the second largest public health system in the state, second only to Los Angeles. We take that responsibility very seriously, and we take our responsibility to all of our citizens in this county very seriously. The distribution and scarcity of this vaccine over the last month and a half has been really a huge problem getting the vaccine into the right arms. The state has been focused on distributing vaccine in smaller amounts to various agencies, and it's become obvious that the amounts going to Kaiser and PAMF are inadequate to care for their patients. Therefore, the county health system is now functioning in a no wrong door model. Effective today, any resident who's 65 or older, wherever they get their health care, whatever their insurance is, whatever their other health care needs are, can participate in the county health system's vaccine delivery program. At the same time, because there is a scarcity of vaccine and because we do have a responsibility to care for those who are at most risk in our community, we are focused also in a laser focus on communities of color and particularly subgroups of the community that are at highest risk. So in addition to the clinics that we have that are available to anybody in the public, we are also reaching out to those communities with clinics at the Mexican Heritage Plaza in East San Jose, at the Gilroy Community Center, which will be up and running next week, at the Gilroy Valley Health Clinic, at the Tully Clinic, at the Burger Drive location, at our Fairgrounds location, at Mountain View Community Center location, and at the Valley Medical Center Specialty Clinic location. All of those focuses will be on people who are in the greatest risk, the greatest need of services. So, people who are 65 and older or qualify in other ways can go to sccfreevax.org and sign up and make an appointment today. With that, I'll end and we'll have questions if anyone has questions.
Jeff, could you clarify the policy that you have to be a resident of a particular county to qualify? There might be tens of thousands of people who are bus drivers or grocery clerks who live in Hollister or Santa Cruz and spend most of their waking hours in Santa Clara County, where they're most likely to acquire the virus if they do get it. Is that policy workable? Do you see a change there?
We, through the county health system, allow people to sign up on sccfreevax.org who are residents of the county or who work in the county. But people coming from outside of the county who don't have an association with the county are, at this point, directed back to their county.
What is your vaccination capacity if supply is not an issue, and what is the state telling you about supply moving forward?
Well, supply is definitely an issue. We currently have enough on supply in our Valley healthcare system for about 2 to 3 weeks. We have been getting small dosages or small inventories of the dosages on a weekly basis from the state. And as we know from reading the newspaper, the state is developing a new system of dispensing. We're very hopeful that we will get adequate amounts to continue at our high rate of vaccination, which is about 6,000 doses delivered daily, Monday through Friday, and about 1,000 doses delivered on Saturday and Sunday, and we'd like to expand to about 15,000, which is why we're looking at other sites in order to do that. However, the big caveat here is we need to get enough vaccine, and the limiting factor in getting enough vaccine is the manufacturing. So we're ready, willing, able, we've got the infrastructure to do it. And all we're waiting for now is vaccine.
NBC, thank you. You brought up both Kaiser and Palo Alto Medical Foundation. You know, Kaiser has canceled a lot of appointments down here, they say, because of the shortage. How much of today's announcement is sort of because of what has gone on with those major health providers?
Well, over the last 3 weeks, it's become clear from looking at the numbers and talking to the other health systems that the multi-county entities did not get a sufficient amount of doses in order to take care of their patients. As a matter of fact, Kaiser was, shall I say, shorted significantly, considering that statewide they represent probably about 40% of the population that's insured. So when we saw that Kaiser was forced to cancel clinics, we had to ask ourselves, how can we fix that? How can we intervene the best way possible? These people who are 65 and older, who happen to be Kaiser members, are at great risk. And so if they're at great risk, we need to do something about it. So that has a lot to do with our changing policy.
So I know when the governor announced that people 65 and older would be eligible for the vaccine, it was somewhat controversial because at the time the priority was people 75 and older. How does this shift in policy, how do you ensure that people 75 and older aren't sort of elbowed out of the way by all of the 65 people trying to get the vaccine?
Great question. And the focus that we're using in the county health system is special outreach. So as I mentioned, we have numerous sites set up in communities of high risk. We've also been continuing our targeted mobile delivery into nursing homes and skilled nursing facilities. We're developing a targeted delivery system for those individuals who are homebound, and particularly elders over 75. And we realize that that group is at great risk, and so we're going to continue to push, particularly in the areas where there's high incidence of the virus.
Just a quick follow-up, if I could. It's my understanding that there was an estimated 120,000 people in the 75 and up. Do you have a rough estimate of the numbers of those folks who have been vaccinated or as a percentage?
A rough estimate of how many people have been vaccinated over 75 is about 37% of the population over 75 that have already been vaccinated, and about 28% over 65. So we still have a long ways to go, and we clearly do not have enough vaccine on hand to get there. But we have assurances from the feds and from the state that the vaccine numbers will be increasing by at least 20%. And so we're pretty confident that we'll be able to push in order to get enough vaccine to be able to continue doing this.
Good Mercury is.
Hi, good morning, Dr. Smith. Today, of course, is about baby boomers, but I need to ask you about another age group. There's so many parents coming to this in Santa Clara County that are making a big push to play high school football this academic year. And they need to do it, they need to start by the end of this month. What will it take for the county to allow that to happen?
I think that's a question for Dr. Cody.
Thank you for the question. I just want to clarify that the state has rules that we must follow, and they have set out which sports are allowed under which tier. Santa Clara County, like most counties in the state, are currently in the purple tier. There are only a limited number of sports that are youth sports that are allowed in the purple tier, and football is not among them. And so we cannot allow sports that the state does not allow. The sports that the state does allow, we, of course, do allow. We are aligned with the state in that respect.
ATVU?
Do you have a timeline of when you're actually going to implement this?
The timeline for the no wrong door, 65 and up, we worked with our partners yesterday. We are announcing it today. And so it may vary a bit by system. Certainly in the county system, effective today, anyone may make an appointment. And I think that the other systems are, putting procedures into place so that they can also accept any patient regardless of system.
ABC?
How far in advance do you know if you're receiving doses? And how long do you anticipate it will take to vaccinate the whole county?
We receive every week notification from the state as to our county allocation. So once a week, we get a number, and then that county allocation goes to the various health systems in our county. I want to clarify that that county allocation is just the doses that flow through the county, not the doses that flow through the state pipeline or the federal pipeline. I just want to emphasize this is an incredibly complex allocation and distribution system.
So Dr. Cody, you kind of anticipated my question in some ways. I mean, we know that the distribution system, that the feds give some out, the state gives some out. To the extent that that's caused problems where people have scheduled appointments and those appointments had to be canceled, do you think that the system needs to be rethought where you guys become sort of the central clearinghouse for vaccines coming into the county and distribute them as you see fit?
In the county, we only have control over part of the system, and our job is to make it as clear and consistent and barrier-free as we can. And that's why today we're announcing this no wrong door approach in collaboration with all of the large systems across the county. So anyone who is 65 and up, doesn't matter where you go to get your medical care, you can register and get vaccinated. A Kaiser patient can come to the county, a Stanford patient can go to Kaiser, a county patient can go to Stanford. It doesn't matter. If you're 65 and up, we want you to get vaccinated. Please sign up and get vaccinated.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.